So, for this semester's complex problem, I chose to do mental illness within schools. What is mental illness? So, a lot of times people confuse the difference between mental health and mental illness. However, there is one component that completely separates the two, and that is time. Mental health kind of talks about just the duration of someone's entire life, whereas mental illness can be broken down into certain time periods. Roughly 1 in 5 adults in America experience mental illness within their lifetime, and it's becoming increasingly prominent within the age range that I'm targeting, which is teens to young adults, so roughly high school to college age kids. So these are some types of mental illness. I'm sure a lot of you have heard of these. However, the three most common within the age range that I'm targeting is anxiety disorders, depression, and PTSD. Who does it affect? As I was just saying, I am targeting teens to young adults, high school to college. However, mental health, it can affect anyone. Mental illness can affect anyone. It's not just limited to the group that I am specifically targeting. While I was doing some research, it says several factors serve as an explanation as to why this group is so vulnerable to mental illness issues, and it's because we find ourselves in a crucial moment of personal and physical development towards adulthood. I can vouch for this. I'm sure a lot of you can vouch for this. During this time of our lives, a lot of people say, like, this is the best time of your life, and it is, but it's also extremely stressful because we're trying to take steps to get a career while we're also maybe working, while we're trying to balance relationships, while we're trying to balance like our own personal time. There's just a lot going on during this time period, as I'm sure there's a lot going on in every time period of someone's life. However, mental illness is becoming more prominent within this age range, I think personally because we're so stressed out and just because there's a lot of change happening. Also, in addition to that, the COVID-19 pandemic did nothing for us. That stressed everyone out, myself included. So, what are the causes of mental illness? As I'm sure you could guess, stress is a huge one, especially according to the group of young adults to teens. But some other causes are listed here, such as maybe isolation or loss of loved ones. Moving along, we have prevention tactics. This was interesting when I was looking it up for schools and even colleges. There is not a lot of prevention tactics in place. I'm not sure exactly why. It was very hard to even find this. However, there is this 6-step program framework. These are the 6 steps down here. But in addition to that, there are things such as therapy, getting on medication depending on what illness you might be suffering from, or just staying active. I think that's more a tactic used to just keep your mind off maybe your mental illness. I'm not exactly sure, but it was highly recommended upon the research I did. So what are some coping mechanisms? Just like anything else, there are both positive and negative coping mechanisms to mental illness. I thought it was really important to separate the two. So some positives would just be developing a routine or talking, going to therapy, which is pretty much which talking could also apply to just talking with friends, talking with family, talking to anyone about maybe what you're going through. Some negative coping mechanisms would be avoidance, self-harm, and substance abuse. These ones are primarily also used by the age range that I'm targeting. I think this is because as young adults or kids, however you want to generalize us, we want instant gratification. We don't want to wait for anything. We want to have something and we want to have it like right now. And I think that's why we primarily use substance abuse and just avoidance to completely just numb out maybe whatever we're going through. How to recognize mental illness. It can be difficult to recognize mental illness, mostly because people are very good at hiding what they're going through. They don't want people to know that they're struggling, so externally they don't let people see, but internally they really are hurting. So with that, most mental illness signs are going to be externally. I have a little poster here on the side of some feelings that you might recognize, such as feeling anxious, sleeping problems, emotional outbursts. Some side effects, they can be both mental, physical, and behavioral. The most stereotypical side effect is just not enjoying your life. You're just unhappy. However, these effects can range from both social to physical issues as well. Those physical issues can be developing diabetes, heart problems, stroke, and more. However, this age range of people that I'm targeting, they suffer from risks of experiencing poor academic performance, poor relationships, low self-esteem, and more. Some solutions. So there really, when I was searching, there is no definite solution to prevent mental illness. However, there are just prevention tactics, which I previously mentioned. But according to MHA, Mental Health America, they recommend a dual combination of medication and therapy to counteract whatever negative effects you might be suffering from depending on your mental illness. So these are obviously subject to change depending on what mental illness you're suffering from. However, it is very important to know that as a person, you can live with mental illness. A lot of people do. In conclusion, the awareness of mental illness is important and it needs to be spoken about more freely. However, it's understandable why people might not want to because, they're embarrassed by it. However, you shouldn't be. Lastly, these are just some references that I used and I spoke about within my presentation. Thanks.